So a lot of patients, when they come to us, obviously they have an alcohol or a drug problem. And when I ask them, what do you think's wrong with you? You know, why do you think you drink too much or use too many drugs? They usually say, well, I'm under a lot of stress, or I had a bad upbringing, or something like that. And I like pointing out to them that those are interesting, but the main factor is that there's something abnormal about people who have addictions brain. So I wanted to just show you a little bit about how that works. So if we look at a brain sort of sideways, it kind of looks like that. And there's two parts of the brain. There's the frontal lobe, where we think and make decisions. But deep inside the brain, there's this area that's called the ventral tegmental area, or the nucleus accumbens, but I just call it the pleasure center. And when I ask people, why do you think we have a pleasure center in our brain, deep in our brain? This is in the automatic part of the brain, so it's the part that keeps you breathing when you're asleep, it keeps your temperature regulated, it keeps, you know, your body's water balance, everything that you don't really want to be thinking about. And deep inside there, there's this pleasure center. It's actually full of a molecule called dopamine.
Okay.
You've probably heard of that. So when I ask people why would we have a pleasure center in our brain, they usually say, well, so that we'd feel happy. And that's a good answer, but it's the wrong answer. The actual answer is survival. People, we have this area so our species will survive. And we get very strong cravings to fulfill this pleasure center with sex and food. And we have very strong drives for that, because if we don't eat or we don't have sex, then our species doesn't exist. We have incredibly strong drives. So strong, in fact, that, you know, we've got 7 billion people on the planet, so clearly the sex drive is good. We have a 40% obesity in America because food is so cheap and available, and people like getting that feeling. And when we satisfy that need for sex and food, we release a lot of dopamine. We can actually see that in a camera. We can take pictures with PET scans, and, you know, and then you see the dopamine go up. Now, the amazing thing is all addictive drugs release about 5 times the amount of dopamine that our brain was ever meant to get in nature. That's why we like them. They really feel good. And so they stimulate this natural system that's there for a good idea, but it overtakes it, it overpowers it because it's so strong. The amazing thing is that 90% of people get that dopamine spike, that dopamine feeling, and they kind of go, wow, that was interesting. Maybe I'll do it again sometime. Maybe I'll have a glass of wine next time with dinner. But 10% seem to be born with a brain and that is abnormal, that is deficient in that dopamine system. The best way to think of it is that they're born with a slightly low level of dopamine. So when they get the dopamine experience from drugs, from alcohol or drugs, their thinking is, whoa, I love that. It's really strong. And it immediately sends messages to the thinking part of the brain that says, I want to do that again. I don't want to get a hangover, so I'll be careful, and I don't want to break the law, and I want to go to jail, so I'll be careful, but I sure want to do it again. So they value that experience a lot more than normal people. It's called salience, is what we use in the medical field. And so they like that feeling more, so they start doing it more, and then the whole disease takes on a sort of a path of its own. So that's basically the only thing wrong with you. You know, when I take your history and I hear about the things that have been going on, it's clear that you have an alcohol problem. And the only thing that's really wrong with you is that you were born with a brain that likes alcohol, that likes that dopamine rush. It's not your fault. You know, I know you've got a family history of it with your parents and grandparents. We almost never see somebody with an alcohol problem that doesn't have a family history. So it's not your fault that you were born with this brain. It was sort of an accident waiting to happen. But now that you know it, it is your responsibility to not drink and do drugs and take care of it so that you have a happy life and that you are able to help the people around you as well.